Welcome back to Rehab and Revive. In today's video, we'll be talking about the dreaded rotator cuff injury. But first, please spend a few seconds to like our video and subscribe to our channel. If you found this video helpful in any way, please consider hitting that thanks button and donating. Also, our team has worked hard to bring online exercise programs to you. You can find a link to our Revive at-home programs below in the description box. We appreciate the support. There are many different kinds of shoulder injuries, ranging from tearing of the muscles that comprise the rotator cuff, tearing of the labrum or cartilage that helps position the humerus inside the glenoid cavity, to overall structural impingement caused by faulty shoulder mechanics and muscle imbalances. In this video, we'll be going over correct standing posture, shoulder setting or getting the rotator cuff muscles of the armpit to activate, cover position, and pec minor muscle tracing to release any restrictions of your pec minor muscle. So let's get to it. Alright, so let's go over standing posture. We're going to start at the feet. You're going to want your feet about shoulder width apart, and you want pressure on your big toe, your small toe, and your heel. Tripods are very sturdy structures, so that's where we're going to base both of our feet upon. Alright, and so that's where our feet are set. Next, we're going to go to our knee joints. You want them to have a slight bend and you want them to feel a little bouncy. Okay, following that, we're going to go to our hip. So our hip, we want to find neutral, and what we're going to do is put our hands kind of right on that hip joint pelvis area, and then we're going to go posteriorly. That's a posterior tilt where you bring your hip backwards, and then we're going to do an anterior tilt where you bring your hip forward, and then right in the middle is where you're going to find neutral or what's comfortable for you. So now we have our feet set, our knees are nice and bent and bouncy, our pelvis is in neutral. So now we're gonna see where our rib cage rests on top of our pelvis. To do that, we're gonna utilize our pinky and our thumb, which is distinct to you. You're gonna put your pinky into your belly button. Your thumb should easily touch the bottom of his xiphoid process. So again, if you have to extend your thumb and your pinky too far up, that means that you're too open. We're gonna wanna draw that rib cage down to where your thumb is pressing right on the bottom of that sternal bone. Once we have that, to set our shoulders, we're just gonna shrug them straight up, turn our palms out, and drop them down. There we go, and then we're just gonna give your neck a slight chin tuck, and that is your correct standing posture. So for our next exercise, we're gonna utilize a folded towel, and we're gonna do an exercise called shoulder setting. So what you're gonna do is you're gonna take this towel, you're gonna stick it right under your armpit area here. The other hand is going to apply a slight forward distraction force. And what you're gonna wanna do is you're gonna draw your left shoulder kind of down and inward to activate the rotator cuff muscles, which are the muscles in your armpit. What you wanna do is actually relax this upper trap and make sure that you're not activating your pec or your lats back here in order to hold the towel here. And so you're really gonna feel that activation of the muscles of your armpit, and you're just gonna try to hold that for 30 to 60 seconds without activating your upper trap, pec minor, or your lats. The next exercise is called cover position, and the goal of this exercise is to activate our shoulder depressors and stabilize the shoulder girdle. You can do this by placing one hand across your chest, and this might be a little uncomfortable for some if you have some type of shoulder pathology. You're gonna take your opposite hand, you're gonna put it under your elbow to provide a downward resistance, and then you're just gonna push that shoulder, in this case my right shoulder, down into my opposite hand. In doing so, you're going to activate your rhomboid muscles, which are shoulder depressors, your subclavian, and the rotator cuff muscles of your armpit that we just did in the previous exercise. You're going to hold this for about 60 seconds and make sure that this shoulder here is not elevated up. You want it to hold it down and activate your shoulder depressors. So one of the biggest problems we commonly see with shoulder injuries is that the pec minor muscle is extremely tight. And when that happens, what occurs is our shoulder gets into this rounded position, and then it throws off our shoulder mechanics. So imagine your shoulder is this ball here, it's in a socket, but instead of sitting nice and firm in this position, it's gonna kind of rotate forward, and then it's gonna mess up your shoulder mechanics here. So what we're gonna do is we can take our fingers or our nails. I'm gonna use this nice little tool we have here at the clinic. And what you're gonna do is just go from medial to lateral or inside out, and you're gonna try to smoothen out that pec muscle as it comes across your sternum and attaches into your arm here, okay? And it's gonna be a little painful, as you can see. My pec minor is tight as well. And you'll just kind of trace that muscle through and release any restrictions you feel. Muscles should be very smooth, so if you run into any hiccups, it means that there's some type of restriction, and you're just gonna go ahead and smoothen it out. And that is pec minor tracing. There you have it. We've listed a few tips, tricks, and exercises you can do to help realign your body, strengthen your shoulder girdle, and improve your posturing. Let us know your thoughts on our video and leave us some love or questions in the comments box below. Please like and subscribe. We appreciate the support. I'm Dr. Nguyen, and at Rehab and Revive, we heal smarter, not harder.